All right. So human beings evolve throughout their lifespans. We all know this. We're not the same people that we are when we're crawling around, pooping and peeing in a diaper. As we get older, we get more mature, and that whole life cycle is that there's a science behind it. As an advanced EMTs, you must be aware of those changes, and you need to know how those various lifestyle changes work from very young to very old. So we start out neonates and infants. Infants are 1 month to a year. Neonates are birth to 1 month. So obviously, I'm sure you all are aware that neonates and infants have quite different vital signs of what we see in the normal adult. So at birth, we see a heart rate from 90 to 205 beats a minute. Within the first hour, that drops down to about 120 beats a minute. Um, your blood pressure in these kids are usually directly related to their weight. So it depends on their weight. Temperatures 98 Fahrenheit to 100 Fahrenheit for the neonates, infants 96.8 to 99.6. And you'll see different, sometimes there's 97.2 to 99.8. They change some, but in that realm is pretty normal. As far as weight, neonates usually weigh 6 to 8 pounds. That weight's going to double by 4 to 6 months, triple by the first year. So as an infant, they gain their weight extremely fast, and that tends to taper off when they get into that toddler age. At birth, neonates make transitions from fetal to independent circulation. And we'll learn later on throughout this class that there can be some complications there that you'll see in the field where that transition doesn't always happen the way it's supposed to. As far as the pulmonary system, neonates are primarily nose breathers, super prone to nasal congestion. If you know kids always have runny nose, it's because they breathe through their nose almost constantly. Their rib cage is less rigid and their ribs sit more horizontally. Infants also have giant tongues compared to the rest of their body. Big heads, big tongues. So it's really easy to obstruct their airway just by tilting their chin or that tongue falling back in the back of their mouth. So remember, you've got to be very careful how you position an infant or a neonate. And their lungs are super fragile. They're tiny. Think of like, those really cheap water balloons you get from like the dollar store and you barely put any water and they break. That's almost the consistency of their lungs. So you have to be very gentle with your respirations. Their nervous system, again, continues to evolve after birth. Neonates have certain reflexes. I'm sure you've heard of the Monroe reflex. You've got the palmar grasp. If you put something in their hand, they're going to reach out and kind of put their hand around it. The rooting reflex, babies just from birth will start to kind of nuzzle the chest. That's a rooting reflex. And then the sucking reflex, it's all naturally kind of intertwined in their brain. It's a natural reflex for them. Kind of looking into more of the anatomy. Fontanelles are your ridges, your lines in the skull. And at birth, those are soft. And what happens is if they get dehydrated, because it's not really a rigid bone structure, they can start to bulge or they can sink in. We see bulging more if there's like internal or intracranial pressure. But if a baby is really dehydrated, you almost feel like dimples on the top of their head. So if you ever walk up to a neonate, the first thing I do is just take my hand and I rub it over the top of their head. And that can tell you a lot because if it's bulging, they've got increased pressure. But if it's depressed, more than likely they're dehydrated. My toddler, I have a 2-year-old, he had a really bad stomach virus when he was about 6 months old. And he had, I kid you not, about that deep of a depression in the top of his head because he was so dehydrated. So, I mean, it's pretty significant. If they're dehydrated, you can feel it. As far as the musculoskeletal system, again, it's going to continue to mature as they get older. Growth plates aid in lengthening those bones. Bones grow in thickness by building on themselves. So they're kind of like a fingernail. They're going to layer on top of each other to extend and to build. All right. I heard you guys talking about the renal system the other day. Can you all tell me what organs are related to the renal system? I'll give you a hint. It's on that slide.
Kidneys.
All right,
Kidneys.
guys, good. I'm just checking, making sure you're awake. All right, so infants, like I said, can become dehydrated extremely quick. Their kidneys cannot produce that concentrated urine. Infant urine consists mainly of water. Their immune system, very passive, usually for about the first 6 months. They're going to receive the antibodies they need from breastfeeding. And you see, that's why there's been a big push over the years for extended life of breastfeeding. All right, as far as psychosocial changes, again, beginning at birth, from day one, the way they interact, the way they communicate is all going to evolve as they get older. As we know, crying is the primary method of communicating distress. You might hear that tonight because my 2-year-old is not happy that I'm in here teaching right now. Some other changes, infants can develop attachments or anxious avoidant attachments with caregivers. Separation anxiety is a real thing, mostly seen in older infants. Infants' desires, plans, and they design an organized routine. So kids on a routine want to stick on a routine. This also helps gain that trust in their caregiver. They know that when the light comes on in the room at 2 a.m. and there's a bottle there, that every time that light comes on at 2 a.m., there should be a bottle there. So they get used to those routines. So as we move in from neonates to infants, we start moving towards the toddlers, which is 1 to 3 years. Their vitals are going to start shifting towards that more normal-tensive and normal adult vital signs. So we're going to see heart rates from 80 to 100, respiratory rates 22 to 37, and those blood pressures anywhere from 86 to 106. And their temperature is going to be more of what we expect as a normal temperature. Your preschoolers, that's about your age 3 to 6. Pulses anywhere from 65 to 120, respiratory rate 20 to 28. And again, your blood pressure stays in about mid to high 80s to 112. So as you can see, the older they get, around that preschooler age, it's starting to be what we would expect from young adults. Again, that passive immunity is lost when they turn into that toddler age. So after that first 6 months, they're going to start to develop their own immunity. You're going to start seeing more neuromuscular growth. Their renal system is going to develop more. That's when you're going to start doing potty training, and then you start having some teething. And teething can start super young. So, you know, my kid, he started teething at like 1 year old. So these are guidelines, but doesn't mean that some of these are set in stone. Some other things, they're going to learn how to speak and express themselves. They're going to master basic language. Some are doing the baby sign language. They're going to play games, understand cause and effect, and they're going to start recognizing sexual differences. For school-age kids, vital signs, 58, 118 beats per minute. Respirations, 18 to 25. Systolic blood pressure, 97 to 120. And I would definitely, guys, make sure you're taking notes of these because the registry likes to ask those questions of, you have a kid this old, what is considered the normal vital signs? So make sure you're paying attention to those and reminding yourself of those. They're going to gain about 4 pounds and grow 2.5 inches each year. Their brain function develops further in both hemispheres, and their permanent teeth are going to start to come in. Some of the social changes, they're going to learn reasoning. They're going to have develop kind of a self-concept and self-esteem. Then you get into your adolescence, 12 to 18-year-olds. Does anybody here have kids? Okay. Anybody have a 12 and 18-year-old? Awesome. So I heard that 2 is bad, 12 to 18 is real bad. So God bless you. But I'm sure you all know these pretty well. Obviously, they're vital signs, more like what we expect for an adult. Respiratory 12 to 20, blood pressure 110 to 131. Rapid growth spurts, so they'll grow, they'll kind of level out, and then have another huge growth spurt. Boys usually finish, girls, excuse me, finish growing around 16. Boys continue to grow to 18. And then this is when their reproductive system starts to mature. And those social changes, they start to gain control of their lives. Privacy becomes an issue. Self-consciousness increases. They may struggle to create their own identity, and peer pressure becomes a major factor. So, we always think back to our own childhood and look at middle school. And we remember a lot of people say middle school is some of the hardest times of their lives. That's when you're going through these changes. You start seeing some antisocial behaviors peak in eighth to ninth grade, greater interest in sexual relationships, and they develop a code of personal ethics. And then we get to early adults. These are going to be 19 to 40 years old, so pretty widespread there. Kevin, you're still considered a early adult. Vital signs around 70 beats a minute, respiratory rate 12 to 20, systolic pressure 90 to 140. So what we expect in a normal adult. From 19 to 25, body should be functioning at its absolute peak, optimum level. This should be the best health of your life is when at 19 and 25 years old. Lifelong habits start to develop, and wear and tear on the bones and changes in the body and tissues start to begin. We start seeing life centered more around work, family, and a lot more of that stress associated with that. They're going to strive to create a place for themselves and settle down. And this is usually when we start to see marriage and childbirth. Then you got your middle adults, age 41 to 60. Again, vital signs now are about going to stay the same. Body is still high functioning or still functioning at a high level, but you're going to start having some vision changes, some hearing changes. The cardiovascular system is going to start getting a little broken down. And that's when we start seeing some more underlying health problems develop. Start seeing some cancers, some symptoms of diabetes and hypertension. For females, menopause occurs in the late 40s and early 50s. And exercise and healthy diet can help diminish some of those effects. So now what are they going to be focusing on? They're going to try to focus on those life goals. They're going to readjust lifestyles as children start to leave the home. They generally have a physical and emotional and spiritual reserve to handle life issues, and maybe caring for children leaving for college and aging parents of their own throughout. Sorry, I have a 2-year-old trying to break in. Unintentional injuries. So we're going to kind of step into some of the causes of death. For toddlers and preschoolers, unintentional school age adolescents, adults, those average ages of 41 to 44. Cancer is a big one from ages 45 to 60, and heart disease and cancer for age 65 and up. Say hi, and then you can leave. So, all right, say hi. Say he just had dinner. All right. Sorry, guys. All right. Life expectancy has kind of varied from years to years. Age 61 or older, we're now seeing approximately 78 years, but this depends on many factors: the year of their birth, the country where this person lives, their general health, medical conditions. It all depends, but right now they're saying about 78 years old. Again, those vital signs that we were talking about also depends on general health. What medications they take, family history, and it really just depends. Some countries have people living to 105. Other countries, 72 is a very old age. So let's talk with our older adults. Some of the things that we need to focus on. The cardiovascular system. Again, this is going to decline with age, largely due to sclerosis. Heart rate and cardiac output decreases. The vascular system becomes stiff, and the ability to produce blood cells declines, as well as the blood volume. What happens to the respiratory system? The size of an airway is going to increase, and those smooth muscles weaken and start to fade over time. So, and the surface area of those alveoli decreases. And we've seen that. A lot of older people have those respiratory problems. And here's kind of a good diagram of that. You see, as they older, they collapse inward, they get smaller, they kind of lose that elasticity that they have. And then the endocrine system. People tend to slow down physically, and also keep up to eating about the same amount of food. Their insulin production drops off, their metabolism decreases, and their reproductive system changes to some extent. So these people are sitting longer, they're still eating those super high calorie meals. However, they're not burning that off like they were before. And this also can lead to diabetes and some other things there. Renal and gastrointestinal systems, they're going to be the filtration function starts to decline. Their kidney mass decreases. Ability to clear waste from the body and conserve fluids decreases. Changes in gastrointestinal function may inhibit nutrients intake and utilization. So what is all this saying? As we get old, all of our body systems start to fade. We know this. We've known this since you were just starting your EMT or probably before that. But we're going to kind of start deep diving on what causes these and how do we treat it. Again, some more here. The teeth get bitter and are weaker. Taste bud sensitivities decrease. Gastric mobility slows. You start having issues with gastric acid secretions, and your anal sphincter changes, reduces that elasticity. As far as the neurosystem's concerned, brain weight decreases, motor and sensory network becomes slower and less responsive, diminished numbers of brain cells, and then you're going to have loss of neurons, but not knowledge or skill. So these people are going to be a little slower, but the knowledge and skill is still there. And then their sleep patterns change. Age-related shrinkage creates a void between the brain and the outermost layer. And then you start having peripheral nerve sensation that's diminished and misinterpreted. All right. How's everybody doing? I know this is stuff that's very it sounds like, yes, we know this. As you're young, you're crying. As you're older, everything starts to fail. But we got to get through some of this to get into the more deep stuff. Any questions with this? We're pushing through. Okay. Sensory changes. Most older adults can see and hear well. Pupillary action and ocular movement become more restricted, and hearing loss is 4 times more common than vision. As far as the psychosocial changes, increased number of older adults in the United States live in assisted living facilities. Environmental problems reduced during the pandemic, and finances may limit access to healthcare and medication. Within the 5 years preceding death, mental function is presumed to decline. Older adults face the issue of mortality, and with good resources and support, older adults in their 80s and beyond can enjoy life and feel productive. So let's start at the beginning. All right. We're just born. Our vital signs, can anybody tell me what our vital signs are going to be for neonates and infants? And I'm going to skip back here. Come on, guys, give me something. What do we see for a heart rate for neonates and infants?
Like 120 to 200.
Okay, so yeah, 90 to 205. That's going to drop down to that 120 about a half hour after they're born. What about some blood pressures? Take a stab at it. Jennifer, I see you wanted to talk.
67 to 84.
Okay. Again, it's going to depend on weight, but in that realm, yes. All right, so let's move on to our toddlers. You want to tell me what the toddler's vital signs are? Anybody? Austin, what do you think, buddy? What about a heart rate for a toddler?
I would go with 180s.
A little slower than that. So we're going to
Little
see
slower?
anywhere between, 80 to 140. So guys, make sure you're writing these down because these are important. From all of this, knowing these vital signs are probably the most important thing. As far as you guys know, as you get older, things start to slow down, but these vital signs are important and you will need to know these later on. Respiratory rate in those toddlers, again, 22 to 37, and blood pressure, 86 to 106 systolic. I'm not going to drill you guys too hard on the temperatures because it varies, but the heart rates, respiratory rates, and the systolic blood pressure is something you guys should know. All right, let's go a little older. What about our preschoolers? Somebody take a guess.
The
Michael,
pulse,
what do you? Yeah,
the
pulse. Give me a
is
pulse.
gonna be, 58 to 120.
Yeah, so close, 65 to 120. And again, guys, if you have a kid and it's in that realm, treat your patient, not just necessarily the vital signs. So, if they're acting sick and they got a blood pressure of, 58, 60, be more concerned if they're acting completely fine and they have a blood pressure of that. So, but ideally 65 to 120 is what you want to see. Respiratory rate anywhere 20 to 28, and that systolic blood pressure, again, 89 to 112. All right, Michael, what do you think for school-age children? What would you give a pulse?
About 60 to 120.
Very close, yeah, 58 to 118. And again, right there in that realm. Respiratory rate's going to start being more normal for an adult, 18 to 25 on the high end, and blood pressure 97 to 120 for that systolic or top number. All right. Who else we got in here? Owen, what can you tell me as far as adolescents, those 12 to 18-year-olds? What are we going to start seeing for their vital signs, pulse and respiratory?
It's going to be like the 58 to 118, and respiratory of 16ish, and then a pressure
Yeah, right
like
there on it.
120 over 80.
Yeah, so pretty much the adult vital signs. So guys, again, as far as this lecture, yes, it's a lot of just common sense. Again, as you get older, things slow down. You start, I always joke and say you start in diapers and end in diapers, but it's really the truth, right? So the biggest takeaway I would say from this is just knowing your vital signs, because that's going to help you down the road. And just realizing that as you age, your body systems age too. So bones, lungs, cardiovascular system, once they mature and they get to that mature point, it's almost like it hits the top and then slowly starts falling back down like a roller coaster. Some people's roller coaster is a lot faster than others, but just be aware as you age, things change. And that's really all I can take away. I don't know if Kevin wants to add anything on this life development one, but there's not a whole lot to really talk about.
Yeah, I mean, I don't test hard on lifespan development because you had all that through EMT school. But I do know that knowing the vital signs are huge. And blood pressures, heart rate, respiratory rate, things like that. You will be seeing those again on quizzes and exams and on the National Registry. But that it's just good patient care to know that.
Yeah.
You'll know the differences between those because it's different than the adult. And to add to this, that's to Zach as well. I'm middle-aged now, by the way.
I tried to give you a little credit.
No, it was nice.
So the key takeaway, guys, and so I will tell you, even Kevin probably the same falls still to this day. make me sweat just a little bit more. And having at least in the back of your mind, knowing what normal should be, instead of having to flip through a book or look it up real quick on your phone, makes life just a little bit easier. So I encourage you on stuff like this to remember it, but also refresh your own memory as time goes on. Every now and then look back at your kids' vitals, because when you get on the call and as an advance, you could be the highest certified person there. People are going to be looking to you for those answers. So just for your own self-worth, try to keep that fresh in your mind. Okay. So I'm going to
pediatrics. We get into pediatrics more, like Zach was mentioning, newborn illnesses, so congenital defects, things like that. And we're going to cover more of that in depth in pediatrics and neonates and neonatology, because we're getting into that part there. But understand that things do change the older you get, and you have other things like medications that are masking certain problems. So understanding, and this leads into the next chapter that he's covering, this pharmacology, is having that understanding when the older you get, your body starts shutting down, and on top of that, we're taking medications that also do some physiological changes within the system. So kind of like a precursor in going into the next chapter. And we'll cover, and I'll be helping Zach out along with this next chapter as well.
Yeah, and kind of leading into this, and we'll kind of go with an example here, right? So let's say you're old and you're having issues with blood pressure. Something they put you on is called a beta blocker, right? So beta blockers, they try to keep your heart rate around that 60 to 80, depending on what you're taking. So if you have a person who's super sick and super septic, or they're needing to compensate, what's something that we normally see in a sick person that doesn't take any medication? What happens with their heart rate? And they're compensating, so the body's trying to take care of more. What do we see their heart rate normally do?
Usually elevates.
Exactly. But if they're taking this beta blocker, it's not going to elevate. So A, the body's not doing what it needs to take care of itself, and it's masking that symptom for you as a provider. So just because someone's sick and they don't have a high heart rate, now you guys got to the knowledge base that it's, oh, well, they're fine. No, could they possibly be taking this? Could they be doing this? Is there a reason that blood pressure is not compensating, or the heart rate is not compensating? So again, we're starting to bridge that gap of the EMT level into more clinical provider level. And we have to set the framework before we start building the 10. Okay. And that's where we are right now. So let me,
when we were going through pathophysiology, do you guys remember we talked about alpha, beta, and H receptors a little bit, right? And those are the things that are being blocked by the medications that we're taking in. So Zach, there is at the end of each chapter, we should be doing the case studies. If you open up JB Learning,
okay,
you'll see in there, go to the case study presentation, and they bring up a decent case at the end of every chapter.
bear with me here,
cover
guys.
that one there.
Apologies.
So, and to find the answers to the case study, if you want to look at them, they're in the presenter notes.
Okay, give me just a second, guys. I apologize.
Yeah, it's definitely a good review. Like the EMT class have review questions at the end. The AEMT and paramedic do case studies.
All right, cool. Bear with me, guys. Just a second.
So as he's looking for it, keep in mind that the things of understand like the down and dirty what the body actually has. So alpha has alpha 1, alpha 2 receptors, and then there's beta 1, beta 2 receptors, and then there's 3 H receptors, which are histamine release. Remember how we talked about that before with patients that have different immune issues where histamine is being released, allowing leukocytes to come in, and you start seeing that inflammation, leukocytes come in as white blood cells, and start attacking that, right? They're trying to break down and fight that infection. So understand what medications patients are on, and that's going to be the biggest part. My biggest take home for you guys is understand the body changes, anticipate what it should be, and then if there are medications, what's going to mask it, right? Those are the big points behind lifespan development and knowing what is going to be happening. All right, I'll let Zach do the case study here.
All right, guys. So you were dispatched to a sick infant. Upon your arrival, you were met by a young mother who stated that her 9-month-old daughter has been crying for the last 3 hours and will not stop. As the mother hands you the patient, she immediately stops crying and looks at you. So, when assessing the infant, the AEMT should evaluate the nutritional status of the patient. What is the usual weight gain per day for an infant? It's a tricky one, guys, I know.
Is it 4 grams a day?
It's 1 ounce a day, but I will
Wow.
give you just a chance. I mean, that's tough. So once a day after the first 2 weeks of life. So the infant usually gains about 1 ounce a day after the first 2 weeks of life. All right. This one's a little easier. How does an infant's airway differ from an adult's?
It can be blocked off by the tongue because the tongue is so big and it's so narrow.
Nice. So that's one. All right. Give me some other ones. There's a few different ones. That's a key one, though. That's a really good one.
Think about how the airway is structured. What supports do you have or lack of their support?
Is it the normal size? Is it the normal thickness of an adult airway, guys? Think about it. You got this fresh new baby
Isn't it a
laying
lot,
there. But
a lot smaller than the
yeah,
adult airway?
proportionally, big head, big tongue, little airway, super narrow, all right? Good job, guys. What about the actual just structure, right? So there's going to be fewer alveoli in the lungs. The surface area is going to be smaller for gas exchange. So things, as far as breathing, they kind of set a baby up for failure, the big head, big tongue, small lungs, small airway. So there's a lot to kind of pay attention to.
Keep in mind that infants and like that, their airways are more pliable because they don't have those solid cartilaginous rings like we do as an adult. So if you have an infant laying flat on their back in a supine position, and you don't pat underneath their shoulders, the airway is going to pinch off. Where if one of us were to lay down flat and in a supine position and have our necks bend, because of the cartilaginous rings, it can still maintain that structure, right? That's why it's so important to pat underneath the shoulders when you're ventilating an infant or a neonate as well. So those are some of the airway differences.
When we get to peds airways, Kevin and I both are big airway fanatics. And that's something we'll talk about is how do you align a ped and an adult to utilize their body structures to help you out. So we'll touch on that in the future. All right, good job, guys. Let's go to part 2 here. You proceed to question the mother, who states that her daughter has been acting normal all day and does not seem to have anything wrong with her, but she just won't stop crying. You evaluate the patient and find nothing visibly wrong with her. You proceed to get a set of vitals. All right, so what are some of the notable development characteristics that you should see in a 9-month-old? So what are some things you should see in a typical 9-month-old? And with you that had kids, you all should know 9 months is kind of a changing point. You start seeing some things.
Their weight double, triples from a neonate.
Okay. What about just things that they do? What would you see?
Much more active.
Okay. So they're going to start to crawl, at least pulling themselves up. This is the time where they're going to start putting everything in their mouth. They're going to start understanding basic speech. So no, and they might enjoy peekaboo. They're just more alert in their natural environment. All right. All right, here we go. What ranges of vital signs would you expect to see in an infant?
A higher respiratory rate.
Give me a number. Guys, don't be afraid to be wrong. This is what we're here for.
Up in like the high 20s. It's like 25.
Okay, so 25 to 50. What about heart rate? Austin, what do you got for a heart rate for an infant?
100 to 140.
Close. 100 to 160. All right. Michael, what about a blood pressure?
Um, roughly 80s over 100s.
Close. You're looking at 70 to 95 systolic. Okay. So, guys, when we're talking about these pressures, right now we're not focusing on that bottom number, that diastolic number. We're worrying about the systolic number. Okay. But looking from 70s and 95 for that top number. All right. Good job. The vital signs you obtain all appear to be within normal limits. However, you do notice some sunken areas in the patient's scalp. When you ask the mother the last time the patient had a wet diaper, she replies about 8 hours ago. What are sunken fontanelles a sign of?
Dehydration.
Good, 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 good. All right. Does anybody remember in what month that we normally see those fontanelles start to fuse together? And then what time they usually close?
I want to say roughly 6 months to a year.
Close. 9 to 18 months is when they start to, or when they're usually closed or closing. They start that closing process and start fusing around 3 months of age. All right. Any questions there, guys? Cool. You inform the patient's mother that you suspect the child is dehydrated and that you would like to transport her for evaluation in the emergency room. The mother agrees. You proceed to load the patient into the ambulance, establish IV access, and administer an appropriate amount of IV fluid. Upon arrival at the emergency room, you turn over care to a waiting pediatric RN. Why are infants prone to dehydration?
Because most of their urine is water, so when they urinate, they're losing all of it.
Close, yeah. So their renal system isn't completely developed, so they can't really concentrate it. So it just all kind of goes out at once. Their body can't really absorb it as well as they need to. Another thing is they're nose breathers and mouth breathers. So all that moisture in their mouth, they're going to be breathing it out and exchanging it, and it dries it out. And so it's replenishing fluids in their mouth and nose constantly. They also, if for any reason they had diarrhea or vomiting or spitting up or have any type of gastric upset where they're spitting up over and over and over again, it can also dehydrate them. So there's a few different ways. Cool. What is an infant's primary means of communicating when they're stressed? Everyone should be able to get this question.
Oh, they're gonna cry.
All right. Easy question. So the first one's super hard. The last question is super easy. So there we go. All right, guys.
So
Throughout your
before you get to the summary, let me ask this question then. We have an infant who is dehydrated. Now remember, infants cannot take a lot of fluid, right? We covered this in last class, I believe. They can't take a lot of fluid in, and they also don't have a lot of fluid in their system, which is why they can become so dehydrated so fast. So multiple bouts of diarrhea, vomiting can put them into a hypovolemic state in a very fast rate. IV access, a couple of little tips of information. There's 2 spots that work very well for neonatal infant access. One is on the foot, and 2 is on the top of the wrist. All right. Those are 2 very good locations to start looking for IV access for neonatals and infants that I found over my years of experience doing IVs on peds. The second thing is how much fluid do you give them, and how do you figure out that equation? And I'm gonna ask you. I'm gonna tell you this here. Let's say that the infant weighs 12 pounds. The big infant. So the infant weighs 12 pounds. How much fluid in milliliters do you administer to this infant? We already covered this the other day. I kept it simple. I just did the math in my head. So
roughly about 54 to 55. So
what was that? Sorry. What's the total amount of milliliters you give, or liters?
Roughly about 55 milliliters.
All right. So how did you figure that out?
Convert the pounds into kilograms. Then
Okay.
then times it by 10 milliliters per kilogram.
Perfect. Then that's actually perfect. So 55 to 60 mLs. Now, your bags of fluid come in hundreds, 500s, 250s, thousands, right? The best way to give this kid a fluid bolus is draw it up in a syringe. A lot of stuff we'll do with pediatrics will be syringe based because we have to be accurate. Because if we just say, okay, well, we're just going to run this fluid in, you're going to deliver 60 mLs with 1,000 bag of fluid hanging, you're going to forget about it. The kid's going to get flooded and it's going to go into the lungs. It's going to go places they don't need to be, right? So we do a lot of things in the pediatric world. We do a syringe-based medicine. So we're going to drop what we need. We're going to administer that bolus. Or we use something called a Brett set, which you guys can use, or Buterol is another name for it. Or at the advanced level, if you're using IV pumps, you can set it for 60 mLs and administer it that way, right? There's different methods you can utilize. But running a 15-drop set, they'll go in too fast. Another thing with pediatric administration, we'll get this later too, but good helpful hints. We use something called a micro set or a 60-drop set that helps you establish 60 drops per ml, so you can count them off if you'd like to. But the best way to do it, establish an IV, you put a 3-way stopcock on it, and you can drop fluid that you need, administer it through a syringe. And Laurel will go over all that with you during pediatric administration and practicals. But I wanted to kind of point that kind of stuff out, that we cannot flood a pediatric or neonates or infants because they can only take so much fluid. Right, that was my little tidbit of information on peds for infants.
Cool. Anybody have any questions over life development, kind of this intro to peds? Any questions at all? Cool. If you all want to go grab a drink of water, go to the bathroom real quick, I'm going to stop this recording, and then we'll switch over to the next chapter. And let's see, it's 6:42 now. We'll start back at 6:50, if everyone's good with that.